Hello and welcome to BYJU'S Exam Prep IAS. Today's big news is a World Health Day that is celebrated around the world on the 7th of April and is organized by the World Health Organization. Today we will be discussing about the history of the World Health Day. Why is it celebrated on the 7th of April? What is the role of WHO today? And with respect to India specifically, how WHO has played a vital role in getting rid of many diseases. But before we do that, a couple of important announcements. First, on 10th of April, Mukesh sir will be taking a workshop on the topic how to prepare for the Civil Services 2023. This is extremely useful for those who are aiming for the 2023 attempt. The link to register for the workshop is given in the description of the video. You can register for it free of cost. Second announcement is that tomorrow's explained session that is live on the YouTube channel of BYJU'S IAS at 8 p.m. will be on decoding the Criminal Procedure Identification Bill of 2022. We will be discussing about this bill in detail, each and every provision of the bill, why is it in the middle of the controversy, and what exactly is the bill trying to achieve. Now let's get back to the big news of the day, that is the 7th of April, also known as the World Health Day around the world. The WHO has announced that the theme for this year's World Health Day is Our Planet, Our Health. Meaning that the WHO is indicating that our health is directly proportional to the health of our planet. But before we go deeper into this particular theme and the World Health Day, it is also important to remember what exactly are the core functions of the WHO. The core functions of WHO include giving leadership on matters of crucial health. For example, we saw that when the COVID pandemic hit the entire world, it was a WHO that was giving guidelines to the countries around the world. Guidelines as in making masks mandatory, working on the vaccine, working on social distancing and different types of norms. Then the WHO also is responsible for shaping the research agenda specifically to ensure that any future diseases can be predicted earlier. The WHO also sets norms and standards for promoting and monitoring the implementation of the standards that they have set. They also offer policy options to countries across the world. Whatever WHO says are only suggestions and advice to the governments across the world. If the governments feel that it is in their interest, they can go ahead and convert that into policy within their nation. The WHO also provides technical support to nations across the world. For example, WHO is trying to ensure availability of vaccines, especially to the least developed nations right now with respect to the COVID-19 pandemic. The WHO also monitors the health situation and assesses health trends across the world. Although there were a lot of people who criticized the role of WHO in the COVID pandemic specifically because they were very late off the blocks and they did not really imagine the kind of danger that COVID would pose to the entire world. However, in the past, we have seen that in most of the diseases, WHO has played a stellar role in ensuring that the diseases around the world are monitored and the advice is given to the nations to improve their situation. Now, as I said, the 7th of April marks the celebration of the World Health Day. The idea was first conceived in 1948 while it came into effect in 1950. Now, this day is specifically celebrated to create awareness about certain specific health themes. For example, in the past, the WHO has used this day to create awareness about issues of mental health, maternal health, childcare, and this year it is about the climate change, with the theme being Our Planet, Our Health. Now, the theme chosen by the WHO specifically points out towards the fact that planet's health cannot be taken separately when we talk about the individual's health. WHO on its official website says that we estimate that more than 13 million deaths around the world each year are due to avoidable environmental causes. And that is why the climate crisis around the world is also a part of health crisis only. Over 90% of people breathe unhealthy air resulting from the burning of fossil fuels. In India specifically, we are aware of this unhealthy air in most of our metro cities where the AQI goes beyond the upper permissible limit as well. There is an increase in frequency of extreme weather events, land degradation, water scarcity. All of that leads to displacement of people and in turn affects their health. So everything that is related to climate change and climate activities, all these natural disasters that are taking place are taking a toll on our health as well. This is what the WHO says, and that is why they are trying to put back the focus on the health of the planet as well. Now, WHO has played an extremely important role with respect to India as well. India became a party to the WHO in Jan 1948, that is soon after our independence. In 1967, the total number of smallpox cases recorded in India alone were about 65% of all the cases in the entire world. And WHO took this as a mission that they have to eradicate smallpox. And in order to eradicate smallpox, the target country was India, because India accounted for, as you can see, almost 2/3 of cases around the world. Thus, in 1967, the WHO launched the Intensified Smallpox Eradication Program. This was a coordinated effort by the Indian government along with the WHO. As a result of this, smallpox was eradicated in 1977. In fact, smallpox is the only disease in the entire world to have been eradicated from the face of this planet, all thanks to the efforts made by the WHO. Another stellar role played by the WHO with respect to India is in polio eradication. India again made a bulk of the world's polio cases just about a couple of decades back. India, in fact, was a part of WHO's 1988 Global Polio Eradication Initiative, having financial and technical assistance from the World Bank. In 2012, a polio campaign was launched in India along with the WHO. The Indian government under this campaign partnered with UNICEF, WHO, Bill and Melinda Gates Foundation, the Rotary International and the Centers for Disease Control and Prevention. All of these worked hard to ensure that no one in India is left without a polio vaccine. That is why, as a result, India was removed from the list of polio endemic countries in 2014, which was a major achievement for India and WHO as well. Thus, the partnership of India and WHO has given positive results in the past in not just one but multiple cases. Now, just like most other international organizations across the world, the WHO also does not have its own way of earning money. WHO also depends upon the contributions made by the member nations. If you look at the data from 2020, it was the United States that paid most amount of money to the WHO, followed by China, Japan, Germany, UK, France, Italy, and Brazil. Now, you would have also noticed when Donald Trump was the American president, he announced that America is withdrawing from WHO. However, when Joe Biden came in as a president, he retracted that decision, and US is again a part of the WHO, thus ensuring that the biggest donor of WHO is back to WHO, that is America. So WHO mainly depends on donations from these nations which are led by America. China also in the past few years has been increasing its donation because it is seen as a way to establish your soft power throughout the world. Another important point that you need to remember from the prelims point of view specifically is the important reports that the WHO publishes. These kind of questions are very often asked in the prelims examination. The major reports published by the WHO include the World Health Report, the Global Nutrition Report, the World Vision Report, the Ambient Air Pollution Report, and also the World Report on Hearing. All of these are published by the World Health Organization. These are all the things that you needed to know about the WHO and the World Health Day. Thank you so much for watching the video.